Okay, welcome once again, everyone. So I am Bala. I'm from Reach Healthcare Services, Bangalore, your host for the evening. So we have Dr. Shruti Sridhar with us to take us through this engaging topic on medical cannabis in chronic pain. Dr. Shruti is based out of Pune. She is consulting in the Purple Coat Clinic, and she is empaneled with us for teleconsultation services. So before we start with Dr. Shruti, we will have a very quick introduction, not more than a couple of minutes, about what we do in Reach Healthcare, and then we will quickly move on to this session. So what we do? So Reach Healthcare, we are into integrated medicine. So we apply the right combination of allopathy, Ayurveda, yoga, Siddha, and homeopathy for the increased efficacy of treatment. We do not rely on a single stream of medicine. So we take integrated medicine to the people through telehealth. We do not operate in physical clinic form. However, we have our panel of doctors through them we are practicing integrated medicine for the public. And we are also focusing on, sorry, my presentation is blocking. Yeah, we are also focusing on integrated wellness science and practice, this platform through which you are here today, to focus on lifestyle enhancements through which we are in the pursuit of eradicating the non-communicable diseases. So these are our key areas. And what are we going to do today in this 60 minutes session is that, so first 5 minutes is mainly about introduction and overview. So then the next 25 minutes, Dr. Shruti Sridhar will present about the medical cannabis. And then the next 25 minutes we'll spend for question and answers. And then the last 5 minutes is for sum up. Yes, a quick overview. Yeah. So couple of requests to make for you. Request everyone to mute yourself till the Q&A session. And whatever the questions you are getting during the session, please reserve and put it in the chat box then and there. So our people in the back end, they will collate your questions and then they will present it for you when the turn comes. Yes, thank you. So here is Dr. Shruti Sridhar. So she is a general physician, a homeopath, a multidimensional doctor, and she is a nutritionist, childbirth educator, and a medical researcher. She believes in a concept that disease or health is multifaceted, and thus most of the chronic diseases require a combination of approach for reversal. No single mode may be effective. So what is a combination of approach? That is integrative medicine. She integrates modern medicine, homeopathy, herbal medicine, orthomolecular medicine, cannabinoids medicine, and lifestyle medicine together to strike the right balance and the increased efficacy of treatment. She is mainly focusing on autoimmune conditions, PCOS, cancer, and neurological issues. And she is one of our flagship consultant for teleconsultation. So here is all about Reach Healthcare and Dr. Shruti Sridhar. And now I would request Dr. Shruti to take charge of the session and present us your insights. Thank you.
Thank you so much, Mr. Bala. And thank you everybody for joining in. I see some 50 odd participants. Great. So today I am not going to waste a lot of time because it's a big presentation and I want to finish it as quickly as possible. The topic is very vast. It is a topic which is very, very close to my heart because chronic pain is something which is under recognized, under treated, mistreated rather. And not a lot of doctors also unfortunately know how to approach the problem. So in my practice since the very beginning, I have seen a lot of complicated cases of chronic pain, and every case has been very unique, and it has been like a learning ladder for me, over the last 5 years. So I'm just collating all that I have gathered, and I'm trying to, make the best of my information to tell you how chronic pain can be addressed and how it should be addressed rather. Before we start, just a quick disclaimer that this is for educational purposes and should not be construed as medical advice, because as I said, every case is unique and it has to be considered that way when we are treating it as well. So what is chronic pain? So everybody knows pain, acute pain, like, oh my God, I am in pain and I, rest that place, try to resolve it and all of that. But there's something called as chronic pain, which in itself is a disease. So if the pain lasts for months or years, it is persistent, or it could be even intermittent, and it interferes with our daily living activities, bathing, brushing, going out, meeting friends, cooking, eating, etc. And it leads to psychological issues like anxiety or depression. Then you are diagnosed as having chronic pain. In the US, they did a study where they found out that approximately 25% of the adults experience chronic pain. In UK, the number is a little higher, around 33%. And in that study, they mentioned very specifically that in developing countries, the percentages are much higher. So I would put a rough estimate around 50% of our population is suffering from chronic pain at this point of time. So you can see the burden of the disease is so much, and so little is done to actually address the problem. This is one of my favorite images, because it speaks a lot. An image speaks 1,000 words, and this image definitely does that. It's an iceberg, as you can see, and it's really deep in the bottom. Now, what we see is this part of the iceberg, that is persistent pain that the patient presents with, a person complains of. And this pain is what is treated if you go to a doctor. They'll give you painkillers, they'll give you certain anti-inflammatory, they'll just try to suppress the pain as much as possible. But what is the pain trying to say? The pain is actually indicating a host of problems that are happening underneath the surface. So it could be inflammation, it could be psychological issues, anxiety, overweight, degeneration, postural issues, lifestyle issues, insomnia, so many things. The list just goes on and on. This is not even the full list. So unfortunately, today, medical as a modern medicine is only treating the pain, but very little is done to actually treat the cause of the pain. So that is what we will be looking into. How do we do that? So when you address chronic pain, now this is a path that I follow, and which I feel is logical enough when we are trying to address a problem of chronic pain. The first thing that you address is the pain. This is for sure, because pain is something which is debilitating the person, unable to perform activities, unable to go anywhere, unable to do anything. So the pain has to be definitely treated first. Now for this, you can use a combination of allopathy, of combination of cannabis, which I'll be talking about in the next section, homeopathy, etc., etc. But once the pain is under control, you have to look for the cause of the pain. Why was the pain there? What was the reason that the pain was so chronic? How do we address that? So that cause has to be addressed. Then you have to prevent relapse. Anybody who is suffering from chronic pain, or any doctor who is treating chronic pain, knows that the trajectory is always up and down, up and down. It is never a straight line. The pathway to healing is never straight. It gets worse, gets better, then sometimes gets worse, and then gets much better, and that's how it progresses. So preventing the relapse, understanding the relapse, and managing the relapse, that itself in itself is a huge task. And lastly, once there is a certain stability that has been achieved, you have to work towards building your health and maintaining your health, so that this whole thing doesn't come back again. So this is the, in a nutshell, what we can do when somebody comes with chronic pain, and how do we address that. All right. Now, as I said, pain is just a symptom. It is giving a clue to us that there is something deeper that is wrong. Some imbalance is there, something somewhere is not right. So we have to understand the causes of chronic pain. Now, if you look into the medical literature, largely pain is divided into cancer pain and non-cancer pain, because cancer forms a huge part of the chronic pain population. And as you know, cancer is an epidemic today, and we have a huge disease burden. And almost 2/3 of cancer people suffer from chronic pain. Now, it could be because of cancer, because of the complications of chemotherapy, it could be because of multiple other reasons. All right, but they do suffer from chronic pain, which makes them worse, in terms of quality of life. So the first cause I'm going to put here as cancer, because as I said, it's a big chunk. Following that are autoimmune conditions. These are diseases where the body is has become its own enemy. There are more than 100 autoimmune conditions that have been identified, but unfortunately only 25 to 30 of them can be tested using lab tests. Especially in India, there are much more advanced tests that are available in the US, in the UK, which we don't do here. Hopefully it will come soon. So autoimmune conditions also form a large chunk in this chronic pain. And the worst part about this, as I said, since only a small portion can be diagnosed, lot of these chronic pain cases are undiagnosed. They don't even know what they are having. And once you go to the doctor, they'll just label you as, you have chronic unexplained pain or chronic fatigue, or some general term will be given, because even they don't understand what is going on with you. The third type of pain is neuropathic pain, which is basically because of damage to the nerves. Now, this is commonly seen in diabetes cases, because when the blood sugar increases, it causes glycation of the nerves and it damages the nerves. So peripheral neuropathy is one of the most common symptom, the burning of feet, tingling of feet, numbness, unable to feel anything, not able to walk properly. So these are some symptoms that they experience. So neuropathic pain is very much up on the list. It's quite common because diabetes is very common. Psychological causes. Now, by psychological causes, I don't mean you are imagining the pain. I don't mean that. Psychological causes means there are certain conditions, like say depression or anxiety, and there is also a term called as central sensitization, where the body generally becomes very sensitive to any form of stimulus. Like even the clothes touching, or the wind touching the face, it can generate pain. So that is what I mean when I say psychological causes, where the brain function itself is altered in such a way that the pain perception becomes extreme. So that is again one of the causes of chronic pain. IBS, or irritable bowel syndrome, or fibromyalgia. Now I put it in a different uh, bar, because it is supposed to be, they say it is autoimmune, but they don't know what it is. As I said, it is a very unexplained cause. When they don't understand what you have, they'll say you have fibromyalgia or you have IBS, because you have an irritable bowel and you have muscular pain all over. Okay, you have IBS. So that's how basically it's the diagnosis of elimination. If nothing else fits the picture, they will put it in these two diagnoses. Metabolic disorders. So as I said, diabetes is there, PCOS is there, hypothyroid. So all these metabolic disorders also present with chronic pain. And deficiencies like magnesium deficiency, zinc deficiency, B12 deficiency. So these things also present as chronic pain. And lastly, musculoskeletal issues, as I said, postural, sitting for too long, or sports injuries, etc. So all these things. So this is broadly, I have tried to classify chronic pain so that you can, kind of identify, oh, I fit in this category or I fit in this category. So you know that, okay, this talk will be beneficial for you. So these are the causes. Now let's shift to the cannabis part of it. Now, before I go into the cannabis part of it, I want to first quickly talk about the endocannabinoid system. Now, this is a very new term. Even for me, it was when I learned it. And it has only come into practice or into casual talk in the last 20-25 years. So the endocannabinoid system, or the ECS, is like any other system in our body. Like we have hormonal system, we have the adrenal system, we have the serotonin system, dopamine system. So like that, we have different things, systems going on in our body. Just like that, ECS is one of it. And the ECS is very peculiar because it is like a master system. It controls everything else. We will see eventually how. So it controls everything else. And the fun part of it is your body produces its own cannabinoids. Yes. So the term cannabinoids were used because it was first found in the plant Cannabis sativa or Cannabis indica. The compounds were first found there. So they were called as cannabinoids. And then they found out that these compounds are produced by our own body. And they were shocked. So they couldn't call it anything else. So they ended up calling it also cannabinoids, but they called it endocannabinoids, meaning that it is produced by our body. And the molecules that are produced by the plant, they called it as phytocannabinoids. All right. So this ECS is one of the most ancient systems, and it runs through all the vertebrates. So it has been preserved through the evolution. So it is definitely doing something very important for our body, that the nature decided to preserve this system. And it is a cell signaling system, in the sense it modulates how one cell speaks to the other. This can be a neural cell, it can be a skin cell, it can be immune cells, any type of cells. How they communicate with each other, that is modulated by this endocannabinoid system. And this is the system that helps us maintain the internal environment against whatever externally is going on. So it's like a feedback mechanism, you can say. So as in this image, you can see that, for example, this is a neuron or a nerve cell. It is having CB1 receptor, which is the cannabinoid receptor. And this is an immune cell, which has the, again, CB2 receptor, which is again a cannabinoid receptor. And they are, communicating through the cannabinoids, all right, in the space that is there in between here. And you don't have to remember this. There's the two types of endocannabinoids in our body, AE and 2AG. Now, let's go to the cannabis and see how cannabis works in our body through this endocannabinoid system. All right. Before that, let's talk about what the endocannabinoid system does in our body. All right. I said it's a master system. So it basically does everything. What do you mean by everything? The first thing it modulates is sleep, appetite, how much hunger you feel, analgesia, or the feeling of no pain. All right. Immunity is a big thing which is modulated by the endocannabinoid system. Euphoria, euphoria in the sense it's not feeling high, but it's feeling joy. This feeling of joy, which is like all these saints talk about, connection to the universe, feeling this joy. So that joy is also an emotion which is part of our brain. So stimulating that also this endocannabinoid system does. Neural protection, so it basically protects the nerves, the myelin sheath which covers the nerves, and it can also cause regeneration in some cases. Neurogenesis, which is what I'm saying, regeneration of nerves that have been destroyed. Inflammation, it is one of the big key molecules that controls inflammation in our body. Inflammation is our body's reaction to anything that is harmful to the body. It could be a foreign substance, it could be a foreign bacteria, virus, it could be metals, it could be chemicals, it could be anything which is disrupting our internal homeostasis. Our body will set an inflammation to kick that out. But the endocannabinoid system is the key that switches it off. Okay, the body requires the ECS to switch off the inflammation so that it doesn't end up damaging our own body. And the last thing is learning and also forgetting. So as you see, we have almost covered most of the major functions in our body, which is regulated by this endocannabinoid system. So you can understand how vital this system is to the body and how important it is to maintain the tone of this system. Like it should not go negative or hypo, and it should not go high or hyper as well. So now coming to the cannabis. So now that you have understood the endocannabinoid system, the reason cannabis works is because the cannabinoids, the phytocannabinoids act on our endocannabinoid system. That is how it helps in so many health problems, which we will see in the coming slides. So the plant cannabis sativa or cannabis indica, there are more strains. There are a lot of strains that have been developed all over the world. They basically have three major types of molecules or active components. One is cannabinoids, which I just spoke about. The second is terpenes and flavonoids. So what studies have shown is that all these three components together actually produces the medicinal effect of cannabis. So now, and the cannabinoids you must have heard, CBD and THC. So CBD is cannabidiol and THC is tetrahydrocannabinol. THC is the psychoactive component of cannabis, the component that gives high. But it not only gives high, it also has a lot of other actions in our body, like it stimulates appetite. So when given to patient with AIDS, patients with cancer who have lost their appetite, this THC component has shown to increase the appetite and cause weight gain in these patients, which is amazing, you know. So THC is, though it's a component that gives high, it has got incredible medicinal properties. And CBD also similarly is highly anti-inflammatory, and it is so complex the way it acts in our body that only in the last couple of years we have understood how complex CBD is and how differently it acts in our body, right? So this is how cannabis basically helps us by modulating our endocannabinoid system. And in pain, especially chronic pain, studies have shown that the endocannabinoid system becomes altered, right? Either the receptors become less in quantity, or the endocannabinoids in itself, the body doesn't produce enough of them, or there is some problem in the interaction between the molecule and the receptor. So these are the various things that they've found out through studies, that how the ECS is altered in chronic pain conditions. Now, so what does cannabis do in pain? So what can you expect if you're taking medical cannabis? That what effects would it show you? As I said, the first thing it does is it does modulation of the ECS. Second, it reverses sensitization. Now, this, don't get scared of the term. Basically, I told you, right, where the mind or the brain becomes, not mind, sorry, the brain becomes hypersensitive to pain stimuli. Now, this process is called as sensitization, and it has been given a name because even pathologically, like if you see the anatomical structure, those also change. The nerve pathways, the brain structures, they change when the person is suffering from chronic pain for more than 10-12 years. So once they change, the pain just persists. How do you reverse that change? Cannabis has the capacity to do that by modulating the endocannabinoid system. It definitely reduces pain because, as I said, it modulates analgesia or pain perception. It brings in metabolic control, especially it improves insulin resistance, reduces blood glucose levels, and does so many other things. So it improves that, and through that, if that is the cause of pain for that patient, then it will improve the pain as well. Improve sleep, this is a big thing that it does. Hedonia or feeling of joy, as I said. So one of the main issues that people with chronic pain have is depression and lack of joy. They're unable to feel anything because they feel this pain constantly 24/7. So when they start feeling joy, that in itself is a big relief for those patients, you know. It stabilizes the mood. And lastly, but not the least, because it is very important, it reduces inflammation. So it basically reduces inflammation as much as your anti-inflammatories do, like paracetamol and the non-steroidal anti-inflammatory drugs which are given for pain relief. They also reduce inflammation, and this cannabis also reduces inflammation, but through a different pathway, through the endocannabinoid system. All right. So now we have understood the ECS, we have understood how cannabis modulates the ECS. So now let's look into what are the studies saying, right? And I have specially put in this section because I have personally gone through more than 50-60 studies on cannabis, or maybe more, over the last 2 to 3 years since I have started the practice, and I've tried to collate everything that I could. And this is not just from one single study, it's been collated over the last many months. So if you take this one review paper, it said that a recent systematic review and meta-analysis of cannabinoids, which examined more than 2454, so more than 2000 patients with chronic pain, and these studies showed that there was a reduction in the pain, and not only that, there was also an improvement in quality of life. Now, this is a review paper. Other than that, we'll also see what other papers have shown, single study papers, animal studies, lab studies, etc. So we'll start with rheumatoid arthritis, which is, I am sure everyone must have heard of it because it's so common these days. Again, it's an autoimmune condition where there is multiple joint pains, even musculoskeletal pain is there, not just joint pain. And it can occur at any point of time. It's not that only older people get it or younger people get it. I have seen women with 20-22 years suffering from rheumatoid arthritis. So what does cannabis do? The main thing that it showed in these studies was there was reduction in morning stiffness and reversal of joint destruction, which was very amazing when they found out. So pain wise, when you use cannabinoids or cannabis for RA or rheumatoid arthritis, pain reduction may or may not be immediate, but over a period of time, because the joint destruction is getting reversed, there is a gradual improvement in pain. That being said, I've had a few cases of RA where I started with cannabis at a very early stage before even they could start allopathy. So homeopathy plus cannabis plus lifestyle changes, and they were negative for RA factor after 3 to 4 months of this protocol. So it's amazing what it can do to your body. Other autoimmune conditions, like I said, IBS, fibromyalgia, SLE, it is anti-inflammatory. It reduces the pain, so it is analgesic. It improves sleep and it improves mood regulation. So these are the outcomes they found out in preclinical studies, and some are even clinical studies. Now you have to understand that only in the last 5 years, or 5 or 6 years, clinical trials have started in the US, Australia, Canada, using cannabis. So the number of studies is much less as compared to an allopathic pharmaceutical product, but it's coming. In the next 5 years, this area is going to explode. Now next, look at diabetes. I told you it improves peripheral neuropathy, it improves glycemic control, so it reduces the blood sugar levels, it improves insulin resistance, and it improves lipid profile. Especially it alters the HDL, that is the good cholesterol versus bad cholesterol ratio. It makes that, it improves that, reduces fatty liver also. Now, next, let's see cancer. Now, this is a huge topic in itself because there is a lot of research that is coming on this. And in the US, they have been using it, like people have been using it by themselves for cancer pain. And they have even had stories where, there have been reversal of cancers after using cannabis. And in Canada, there is one big study which is going on, which will come out in 2025, where they are integrating cannabis with very low dose chemotherapy for cancer, so that, they can avoid the side effects. The chemotherapy also does its part and the cannabis also does its part. And this study will come out in 2025. So we'll know, how it's going, and I'm sure, but it'll be good. So in cancer, what we see, one of the most important uses in cancer is chemotherapy induced nausea and vomiting, CINV we call it on medical terms. And it is very, 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 very common. Almost 70% of patients receiving chemotherapy will experience nausea and vomiting. And sometimes it is uncontrolled nausea and vomiting. And even appetite gets suppressed. So post chemotherapy, during chemotherapy, even between two rounds of chemotherapy, doing cannabis is of huge, huge, huge advantage, right? And also, there are no studies in this, but we have seen that when patients start using cannabis, the number of chemotherapies that they require also reduces almost by 50%. And other than that, there is reduction in pain, improved quality of life. There is mood enhancement, feeling of joy, improved sleep. And lab studies and preclinical studies have shown very definitive anti-tumor properties, that they stop the tumor from growing, they stop it from sprouting blood vessels, they even shrink the tumor in a lot of cases. So they have shown all these in animal studies and preclinical studies and lab studies. In neurological conditions, as I said, it's neuroprotective and it also helps in neurogenesis. So obviously it is very helpful in neurological conditions. I have seen some amazing results with early stages of Parkinson's, Alzheimer's, dementia, and multiple sclerosis. And in multiple sclerosis, especially, it improves the stiffness. And also certain conditions like ALS, amyotrophic lateral sclerosis. These are all autoimmune conditions. All right. So they don't have much hope in terms of what allopathy or modern medicine can offer them, but cannabis has a lot to offer in these conditions. And I totally believe in it, because my first case that I used cannabis was a 1-year-old baby with a genetic condition, having severe neurological issues. And I have seen her progress in the last 2 years. And it makes me really, happy to see that I caught medical cannabis at the right time, and I could, give it to this baby, and she really responded well to it. So so you can see reduction in pain, reduction in stiffness, fasciculations, tremors, all that go away. And it is also neuroprotective. So I think I've tried to cover most of the conditions. Obviously, I cannot cover everything. In the next week, I think we have another talk scheduled with Reach only, where I'll be talking more in depth about chronic pain and how to address it. And we are also coming up with a program to treat chronic pain, because as I said, it's very, very complicated sometimes. And we need to know, we need to have a proper plan to go about it. So what is the take home message from today's talk? So I just want to summarize whatever we spoke for the last 30 minutes or so. First thing is to understand that pain is just a symptom, and treating the pain is not going to treat the cause. And cannabis not only offers a palliative option, as in to just treat the pain, but it's also curative in a lot of cases. Like we saw, it reduces inflammation, it reverses autoimmune conditions, sometimes reverses cancerous cells. So all these things are curative. So that's how it helps. It helps both palliative as well as curative. It works best in an integrated approach. Now, this is what I have understood from my practice so far. Cannabis alone can help in maybe some conditions. I'm not saying no. But if you want a real effect, cannabis is amazing. It works amazing when it is integrated with other therapies, especially Ayurveda, homeopathy, lifestyle changes, all these things. When you integrate, sometimes you also need allopathy, like I said, low dose chemotherapy along with cannabis. So like that. So proper integration, it really, really enhances the effect of cannabis. It can help reduce other medications. Like I said, it can reduce your diabetes medication, your cholesterol medication, your pain medication, etc. One thing to remember, that it should not be used in acute pain. So acute pain means like fractures, fall, injuries, post-operative pain. So these are acute painful conditions which might last for 3 days, 5 days, maximum 2 weeks. but it will go away after that. So these conditions, usually cannabis doesn't respond. So don't try to use it in cases of acute pain. And lastly, individualization is very, 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 very important. Like, I don't think any two chronic pain cases of mine have had similar treatment approach. It has never happened. I'm yet to see that to happen. So individualizing the treatment, even the dose of cannabis, how it is taken, when it is taken, how much it is taken, has to be individualized. So the doctor needs to understand how to individualize the dose and the treatment plan for the person. All right. And quickly, I want to cover the legal aspects because I'm sure there will be a lot of questions on it. Now, medical cannabis. Oh God. Shit. Okay. Can you hear me? Hello? Hello?
Yes, doctor. We are able to hear you.
Okay. My current just went. So my Wi-Fi will switch off and then switch on. So I'm not sure if it's going to go. Anyway, I'll continue. And if I disconnect, I'll reconnect and come back.
Sure.
So quickly, just covering the legal aspects. Under Schedule H, even under Ayush, the whole plant extract from the leaves is considered legal. All right. So you should not worry about, am I consuming something illegal? Will I be caught? Will something happen? It requires a medical prescription by a doctor. MBBS or Ayush, both are fine. And it cannot be purchased over the counter. So as long as you have a legal prescription, and you have bought it at a right source, at a legal legitimate source, you should have no problems using it for any purpose. All right. Right. So these are some of the studies which I have used. Much more than this, I couldn't put all of them. And yeah, that brings to the end of my presentation. Thank you so much for listening.
Thank you so much, Dr. Shruti. This was extremely enlightening session. So we got to know a lot of fundamental stuffs that people do not understand in the common world. Hope this stream of medicine would give a lot of ray of hope for many people who are undergoing chronic pains. Yes. So now we will quickly go through the questions that are coming from beginning. Yeah. Just give me a minute. I'll just organize the questions for you. Okay, starting from beginning, it is yes. So Mr. DC Craig Dawkins said that not valid DX without biopsy. I don't know. This is not a full question, but maybe Mr. DC, if you can unmute and speak.
No, it's okay. I know
Okay.
him.
Okay.
It's fine. Okay, so okay, I'll take up a few questions. Anirban has asked, how do I know if I have autoimmune disease? So it's basically a list of lab tests that tell you if you have autoimmune condition or not. First, main thing is pain, like random pains in a lot of places, or particular joint pain, particular pain. And there are a lot of diseases, already diagnosed diseases, which are now coming under the autoimmune purview, like now they are saying, oh, like multiple sclerosis, they know now it's autoimmune and etc. And there is no single test. As I said, there are more than 100 diseases under this bracket, so there's no single test. CRP may or may not always be high. That is another thing to remember. So there are a lot of other factors like complement factor, then there are other anti-nuclear antibodies. There are so many other factors which can be positive, and CRP might not be positive. So it's very hard to say. Can having thyroid masses also cause pain on other parts of the body, such as chest and neck? Gwen, it's possible if this mass is impinging or putting pressure on some nerves that is supplying to the chest and the back. So it is definitely possible that that could generate the pain. How to manage severe pain during periods? Yeah. So, Suman, this is a very nice question. Lot of women face this severe pain during periods. You have to understand that pain during periods is not normal. And if somebody has it, it means that their estrogen levels are very, very high. And that has to be addressed first. And that is one. Second thing, if the pain is really bad, it could mean something else is also going on. It could be endometriosis, adenomyosis, and other conditions which can cause the pain. So the cause has to be addressed, right? And I would say if I have to give cannabis to somebody who has got severe pain, the first thing I'll do is form a protocol for correcting the hormonal imbalance. Give the cannabis because the cannabis also helps in the hormonal imbalance, and it will reduce the pain gradually. As I said, it does not work in acute pain. So if you have severe pain during periods and you take 5 to 6 drops of cannabis or 10 drops of cannabis, it may or may not really work for you. So in acute pain, it doesn't work. Is cannabis addictive? There is a short answer and a long answer. The short answer to this is no. The long answer is medical cannabis is not addictive. That is what I will say. And if there is somebody who is smoking joints, weed, 20 joints in a day for like 6 months, 1 year, then definitely cannabis is addictive. All right. Medical cannabis, we do very low dosing. It's called as microdosing. And at that dose, it has no, even at a higher dose, it has no addictive properties. Okay, the drugs like heroin, hashish, those drugs have got addictive properties wherein you have them once and your body starts craving for them. Cannabis is not like that. I've had so many patients who've taken it for a short period of time, say 3 months, 2 months, and then stopped it. They are completely fine. All right, so it's not addictive. Can cannabis help treating diabetes? Yes, I told you, diabetes is a huge thing which cannabis can help. I've had patients who've had very bad glycemic control and they refuse to change their diet also. And so I started on cannabis, and after that, the insulin resistance improved, the sugar levels came down, a lot of things changed. Blood-brain barrier, Mr. Pinakin, does it cross the blood-brain barrier, you mean? It does cross the blood-brain barrier, but it also depends on the way it is consumed. Like for example, if it is smoked, it has got a different effect. If it is taken orally, it has got a different effect. If you take it rectally, which also we give sometimes through the rectum, that has a different effect. So it depends on yeah, the route. Mr. Craig said decreases insulin resistance with lifestyle and diet modification. Yes, Dr. Craig, very true. How does it help in hypothyroidism? Suman, I have to tell you that cannabis doesn't really help in hypothyroidism, although it helps in hyperthyroidism, where the TSH is very low. So that is the condition where cannabis helps. Hypothyroidism, it doesn't really help. However, if somebody is experiencing sleep issues, anxiety, other things along with the hypothyroidism, you can give it as an add-on. I give it as an add-on to just kind of calm them down, so that also helps in the process. Does it have an effect on the gut bacteria? I don't think so, and also I don't think any studies have been done on that, so I really wouldn't know, but I don't think so. Will cannabis prevent knee replacement? Jayashri, so it can definitely prolong it. So in osteoarthritis, which I assume is the cause for your knee replacement, I don't know. In osteoarthritis, there are stages: stage 1, stage 2, stage 3. So in stage 3, where a lot of joint destruction has happened, it cannot be reversed, but it can definitely help in controlling the pain. I do have a case that has been suggested knee replacement, but she doesn't want to do it, and we are managing with oral cannabis as well as application locally in that particular knee joint, and it is working beautifully. And she did not respond to anything before that. No homeopathy, no allopathy, nothing she was responding, but we used cannabis, and immediately within 2 weeks she said, I'm feeling so much better. So now she's continuing to do her routine activities and all of that. Suman, can it be used as a supplement in middle aged? Well, I think if you ask me, everybody in middle age today is sick. So it will help you in some way or the other if you use it as a supplement, because I'm sure some or the other health issue everybody has by the time they reach 40, 50. Yogesh has asked, where can we buy cannabinoid medicine? What is the essential dose? How long can we take? So Yogesh, there are companies which are manufacturing medical cannabis, but as I said, you cannot get it without a prescription. So if you go to a doctor who knows how to prescribe medical cannabis, he or she will guide you as to where you can buy it, how to buy it, what is the dose, what is the contraindications, everything. And again, how long you have to take depends on your condition and whatever the doctor feels is right for you.
I take this question and e-certificate. We are going to give certificate for the main programs that we are going to host from the next week onwards. Not for this session, basically.
Okay. So, hi, Mr. Pinakin. I got your hi in the chat. Lalita has asked, is it addictive? And I think I have covered that in the talk. Cannabinoids is being projected as a wonder medicine. Yes, Pratibha, I totally agree with you on that. It is not, however, a wonder medicine. There are, limitations to every medicine, but the research is at its infancy. Like most of these allopathic medications you take today has been researched for 40 years, and then they come into the market. Cannabis is very recent compared to all that, and only now money has been pumped in to do some research, and they're coming out with studies and all of that. So it is only in the next 10 years we will know how it is. But keeping in mind whatever studies have been done and the basic pharmacology of cannabis and the basic understanding of the human anatomy and physiology, we do see a lot of beneficial effects in various conditions. All right. Downsides, not really any major downside, but I do use it with caution in certain conditions. Like, for example, somebody with epilepsy, with history of psychiatric issues, history of schizophrenia, severe liver damage, where the liver is almost failing, liver failure, severe kidney failure. So these are certain conditions where obviously one has to use with caution. But as I said, please go to a doctor who is trained in using medical cannabis, because there is a lot of literature in it. I'm not saying like there is a lot to it than simply side effects and all of that. No, there's much more to it. Thank you, Pinakin, for your very, very kind comments. Thank you.
Yeah, to Suman, we will post this in our YouTube
There's
link.
one last question. Let me just take that. Can you elaborate the role of degenerative neurological conditions with respect to blood-brain barrier? This is a very good question, Pinakin. I think I have to get back to you on this. As far as I know, it does cross the blood-brain barrier, and that is how it has got the stimulatory effect in the brain. So that is why when you orally consume cannabis, also there is a chance of getting stimulated, mentally. So that definitely crosses the blood-brain barrier, but I'll have to come back to you on how it affects specifically in terms of MND ALS. I'll definitely get back to you on this. Satish said, my dad is having diabetic patient having burning feet. Yes, Satish, you can definitely use cannabis in neuropathic pain because of diabetes. Even though the diabetes is under control, maybe the damage has happened when it was not in control. So give him, if he's on cannabis for say 2-3 months, that will reverse the damage that has happened. Yoga follower can sound yes. So there are a lot of natural things which increase our endocannabinoid tone in the body. One is like waking up early in the morning, spending time in nature, consuming a lot of good fats, so good saturated fats. Because the raw material for producing the endocannabinoid is fatty acid. So if you're consuming enough fatty acid, which is in the form of omega-3, which is there in flax seeds, in nuts, in fish, etc., it can automatically boost your, even chocolates, so it can boost your endocannabinoid system in a natural way also. Surya says I'm diagnosed case of RA with methotrexate. Yes, Surya, you can do that. Please come in for a consultation. It would be better because, as I said, there is no fixed protocol for people that I can tell you. And even if you want to use it, you will need a prescription. So, you will have to come and talk to us. Arul. Dr. Arul, I don't want to give any dosages on this platform. This is mainly for lay people to understand medical cannabis. As I said, the dosage is highly, highly individualized. How long can we take cannabis for pain? Again, Rashmi, it depends on your condition. Like if it is, let's say, multiple sclerosis or ALS, which is like a life-limiting disease, you have to take it lifelong. You are going to have that part of your life. That pain is going to be there. So it depends totally on what is the condition that is causing the pain. Cannabis is a medicine, or they really extracted from it? Is extracted, Ria, from the plant. So they have a special extraction process where the leaves of the plants are used and the oil is extracted, and that oil is put in a base oil or a carrier oil, and that is sold as medical cannabis. Can you illustrate one clinical case and dose given during the treatment and availability of cannabis in Mumbai? Dr. Shraddha, as I said, cannabis is available everywhere. There are registered legal platforms that sell them with proper licenses. So you can just, it is not available in retail anywhere. So you have to order it online. There is no other way you can order this. And homeopaths can also buy this for their patients. Yes, as I said, under Ayush, it is legal. And even in homeopathy, cannabis sativa as mother tincture is available. So you can also use that. Thank you, Gwen. I think it will be shared. The presentation will be recorded and shared.
Yes.
Will
Yes,
this
yes,
reverse
Doctor.
diabetes? Murugesa. So as I said, it can help with it. It can't reverse. It has to be integrated with lifestyle, medications, food, diet. Yes, I do treat by telemedicine. You can, Satish, you can get in touch with Reach and they'll put you through to me. All right. I think we have done, right?
Yeah, almost.
Right.
Dr. Sindhija Ravi has asked one question.
Yeah.
As you mentioned, our body produces its own cannabinoids. Can you explain how? Any specific food
Yeah. So as I said, so high fats, going out in the morning, waking up early, laughing with friends, all those things, they produce cannabinoids in the body.
Yes. Dr.
Garrick,
Sridhar want to
can
contact
you get medical benefits by smoking it? Yes, Garrick, you do get medical benefits by smoking it. But what happens beyond a certain stage is that in case of smoking, the side effects become more than the beneficial effects, mainly because of the lung damage that it causes. So I won't really recommend it. And also legally, smoking cannabis is not allowed in India. In the US, people are still doing it. And for acute pain relief, it really helps. So as I said, in medical, the oral cannabis will not work in acute pain, but smoking cannabis will work in acute pain. But that is not allowed here, sadly. So I cannot give that as an option. Mithun has asked, can it be used for back or spine pain? Definitely, yes. I have treated a lot of cases with back pain, combining homeopathy and cannabis, and very good results. Yeah, I think we are done with the questions.
Yeah, done. Yeah, I think it's fantastic participation from the people. And as we understand, more than 15 doctors have joined this session, and we could see a lot of engagement from doctors in the comments. Thanks everyone for appreciating Dr. Shruti's efforts here.
Thank you.
And we are fully encouraged by this such a participation. That's very motivating for us. Now, as we said earlier, we are going to continue this session in a detailed form from next week onwards. Please stay tuned with us, and we will keep you posted on the upcoming sessions. And anyone who would want to have one-on-one consultation with Dr. Shruti, please connect with our team in the numbers given in the chat.
Can I add something in this? Sorry.
Yes, ma'am. Yes,
So
yes,
we
please.
are coming up with a chronic pain reversal program, and it is specific for non-cancer pain because cancer, as I said, is a complicated topic in itself. And this program has been very close to my heart, and I have seen some amazing results after introducing this for my patients. So it's an integration of all the best practices. As you can see, there's cannabis, there's homeopathy, there's yoga, and parts of yoga which people normally don't teach. So all those things we are going to integrate in that. And in the webinar regarding that, probably it will be next week, we'll be even explaining in detail how we'll go about this.
Great.
Thank
Great,
you.
Doctor. Thank you so much. Thanks everyone for joining us. Please stay tuned with us. We will keep you posted on the further events on the same series. And I'm sure this is going to be helpful for the entire humanity. Thanks, Dr. Shruti, for your
Thank you.
wonderful session. Thanks everyone for taking your time. See you.